I've been married for 29 years. I have 7 children, and all but one has moved out of the house, gone to college, have their own lives. So I figured now it's time for me to take care of myself so that I can finally look good after bringing up them.
A tummy tuck is the lay name for an abdominoplasty, and it's an operation that's often done after pregnancy or weight loss where someone has a lot of looseness in their abdomen. A big part of the procedure is removing loose skin, but most of the time we're also tightening the muscles that can be weak from pregnancy, weight gain, or previous surgery. The way that I do the procedure is to try and simplify it for patients to reduce the risk of complications and make it as easy as possible afterwards. We have utilized a technique where we do not use drains, which are at best a nuisance for patients. We have pretty much eliminated the fluid loss from the lymphatics or bleeding with the technique we're using, that we are doing liposuction at the same time to thin out the remaining fat, which allows us to take out just as much loose skin as before. But by not cutting all the blood vessels and nerves, we have better blood supply and better sensation, which in turn leads to quicker healing, less chance for infection, less chance for skin not to survive or open up.
I did a little research on my tummy tuck. I had talked to previous physicians, and I didn't really like the way that they were going to proceed with my tummy tuck. It was going to be an overnight stay at the hospital with drains and just a real big deal.
That as well.
They remove all of that tissue, and then they have a lot of potential bleeding or fluid collections, and that's why they use drains. And then they sometimes put in quilting sutures, which take a lot longer to try and control the drainage. So this is trying to keep it as simple as possible, and we get the added benefit that someone who has a thickened fat layer doesn't need a separate operation for liposuction.
Dr. Gray was able to put my mind at ease the way that he does them. He has his own facility, and I just felt comfortable with him.
You could think of it that if it would often be 3 inches worth of fat that's being removed from the tummy tuck. We are using liposuction to thin it out, so half an inch remains, but with that are remaining the blood vessels and lymphatics.
Okay.
Well, with using this technique, another advantage is we can do tummy tuck on someone who's had an old-fashioned gallbladder surgery with a long scar in the right upper quadrant. If you have a cut up here, a scar,
Yeah.
you worry about that the blood flow from here doesn't get past the scar, and but I'm leaving all the little blood vessels attached in through here, so we have an enriched blood supply. I'm not aware of anyone around here doing it the same. I would say that throughout the country more and more people are starting to do it, but most do it, as far as I'm concerned, the old-fashioned way that I was trained in about 30 years ago, cutting everything and then hoping you don't have fluid problems. The big advantage is as they're mobilizing, they don't have to worry about carrying around a few drains with them, so it makes it a lot easier to care for themselves afterwards. Tummy tuck takes a little under 2 hours typically. Usually they're in the recovery room for about 45 minutes afterwards. Then they go home, they walk out the door.
I can remember waking up here, and everyone was wonderful. The nurses were wonderful, and they was telling me that you wouldn't be able to stand up straight right away. And so I said, okay, and that was fine. So, of course, you're getting out of the bed, and you're walking out to go home, and you are bent over. When I first got home, I'm thinking, oh, it doesn't really feel any different because you have all this padding on and your binder and everything. And when I actually was able to take everything and just look at it, I was amazed at my stomach was gone. It was beautiful. Sutures and all, steri strips. I was just so happy of the way I felt. And this is just hours after coming out of surgery. It was just amazing. Gray, I didn't have to have the drains. I didn't have to have a hospital stay. It was fairly comfortable with Dr. Gray.
I would say with most patients, they're back at full activity somewhere between 4 and 6 weeks. Most are taking pain medication for a week or so. Oh, scars usually take 3 or 4 months till they fade out pretty good.
Every day got better. You can't walk upright. Of course, your muscles, everything's tightened, your skin's tightened. So I did walk, stooped over for a little bit. Um, I slept in a recliner. I was out of work, but every day got better. My husband is very happy with it. He was a little skeptical at first because it's a serious surgery, but he's very happy with it. Okay. We just came back from Florida, and I was in a two-piece bikini down there, so that's the only place I'd do it.